We are still missing one of our panelists, but I'm told he's here, and he'll be with us shortly, I think. So let me just introduce our panelists very briefly. You've got their data, but just in the order in which they're going to speak. We're very lucky to have Paolo Sison with us, who's the Director of Innovative Finance at Gavi, and comes also with an extensive background in finance and international capital markets. We are going to have with us soon Christopher Egerton Warburton, who is the founding partner of Lionhead Global Partners, a merchant bank based in London and Nairobi. And he's also been working very closely in his current and past incarnations as for the development of IFIM, and I think he's a board director of IFIM as well. We also have Lelio Marmora, who is the executive director of UnitAid, which is a global health initiative hosted by WHO in Geneva, largely financed by a levy on air tickets. And we have Adam Bornstein with us, who is the Innovative Health Financing Specialist at the Global Fund. So without further ado, we'll make a start. I think our last panelist is joining us, so welcome. That's Christopher. Anyway, I think we enjoyed a very good session this morning, and I think we had a very good interchange of questions and answers, and it was really beginning to feel a lot like a workshop rather than a series of presentations towards the end of this morning, and I very much hope that we can continue that level of participation this afternoon. So I'd like to start off with a question to Paolo. So Paolo, when people talk about innovative financing, one of the first examples that usually comes up is Gavi's International Finance Facility for Immunization, IFIM. Can you briefly describe how the facility works and how you're able to convert 20 and 30-year government pledges into cash on the capital markets?
Happy to. Thank you, Juan, and good afternoon, everyone. It's a pleasure to be here, and indeed enjoyed the rich conversation this morning and early afternoon. The concept behind IFIM is quite simple. I think what makes IFIM work so well for Gavi is the way it is executed, and to that, kudos to the World Bank. And to the IFIM board, who Edge, in one of his incarnations, currently sits in at the moment, is also one of the architects of IFIM during the early days. So IFIM works by having secured long-term legally binding pledges from donor governments, 9 donor governments, some of which are represented in this room, and then in turn using that capital base as backing for going to the capital markets and issuing bonds. And through that mechanism is able to accelerate these long-term funding that go out to 2029, 2030, so 20 plus years capital commitments from donors, and in turn borrows from the market at fairly, really attractive costs and efficient costs. The bonds that IFIM issues are investment-grade bonds. IFIM is currently rated AA1, and therefore provides very low-cost funding. Although there is no guarantee that it will always be the case, historically, IFIM has been able to borrow in aggregate at a funding cost below the weighted average funding cost of its donor governments. So you can imagine how efficient that is for Gavi. What that has done for Gavi, it has been a game changer for our immunization model. I mean, it has allowed us to accelerate our interventions in immunization and therefore be able to help save lives earlier rather than wait for these funds to come and when these pledges are due. That has also allowed us to accelerate our support of health system strengthening and scale that in countries. So Gavi serves the 73 poorest countries around the world. And that has also enabled us to have a stronger leverage in negotiating with vaccine manufacturers and shape markets. So indeed, Gavi funds vaccine purchases. But one component of that formula, of course, is the cost of the vaccine. So the more capital we can deploy against the vaccine purchases, the lower we can bring vaccine prices and the more sustainable those markets can be. The governance of IFM is as follows. So IFM is a charity that's UK registered. It's an independent charity with no staff. So it just has a board that serves on a purely voluntary basis and lend their capital markets, financial expertise, etc., into the governance and the strategy of IFM. IFM's operations are supported by two organizations, one of which is the World Bank, who provides all the treasury and financial support to IFM. So the World Bank is IFM's treasury manager, and the other operations are supported by Gavi. Our support we give to IFM as a donation because we're essentially the only beneficiary in any case of IFM funds. So one reason why IFM is able to borrow very attractively from the markets is because of the mechanisms, the risk mechanisms, and the financial mechanisms that the World Bank has so efficiently placed into the structure. So the World Bank's role as treasury manager enables them to implement a number of measures, including, for example, what's called a gearing ratio limit that places a limit on the amount of leverage that IFM can have at any given point in time. Leverage based on the present value of donor pledges, which means that IFM is always over-collateralized. There is also, for example, a liquidity requirement that requires that IFM should have cash on hand that would be sufficient to pay for interest and principal payments on any of its bonds 12 months in advance. So all of this together is modeled so that the inherent risk, the inherent operational risk within IFM is equivalent, as far as the World Bank is concerned, and as far as their standards is concerned, is equivalent to a AAA risk, which therefore means that it's a very attractive investment for investors. What that does to Gavi is we basically have a ready source of funding, a ready source of low-cost funding, should there be a need to accelerate funding. For example, if there's an unexpected or unmet funding that comes about. That then gives us a lot of operational flexibility, and also at a cost that is very attractive. I mentioned that IFM has 9 donors. They're the UK, France, Italy, Norway, Australia, Spain, the Netherlands, Sweden, and South Africa. Brazil has made a commitment to become a donor to IFM, so that's currently being worked out. So far, IFM has issued bonds totaling $5 billion, of which more than $2.5 billion have been disbursed to Gavi. And of Gavi's funding, financial disbursements from IFM's inception in 2006 to 2014, IFM funding had accounted for 1/3. And a lot of that happened during the early days of Gavi's existence, which explains the reason why Gavi was able to accelerate its programmatic commitments.
Okay, so maybe, Paolo, maybe I could follow up on. Maybe I could follow up on this then with a further question. So, based on your experience with IFM, how would you suggest one should design a robust and flexible financing facility for pandemic response? And building on some of the discussion this morning, do you think that the model could be adapted to increase cash flow for preparedness as well as response?
So I think what IFM is able to do and able to do well is make funding available very quickly and at low cost. It is able to do that in a way that bridges the timing of when donors can fund the vehicle to when those funds are actually needed, which I think is an important element if one were to think of being able to mobilize funding quickly, for example, to respond to a pandemic, where one will not know the timing of when those funds will be needed, but it will be important to be able to mobilize those funds when they are needed. I think it's also, and again, whether it is IFM or an IFM-like structure, I think two key characteristics that make IFM work, which may have some relevance if one were to think of how a pandemic financing solution or one component of that might work, is there is donor commitment which provides assured capital. So that, I think, and then that enables IFM to raise financing. I guess there are a few, perhaps, issues or characteristics. One, if one were to structure, therefore, on that basis, there are probably a few issues or characteristics one would need to think about. In the case of a pandemic, you want to be prepared to fund it, but you don't know when that funding will be needed, or even whether that funding will be needed if there is no pandemic, right? So one potential item one would need to solve for, if you were to fund a vehicle with binding donor commitments in order to be able to borrow cheaply and all of that, what happens with those donor commitments if the funding is not needed? Obviously, donors don't want to pay into a fund and have funds that are dormant. So perhaps one thing one can think about is, although these donor commitments might be legally binding, you could assign some sort of conditionality to them, where, for example, a donor where a donor, for example, would make a 10-year commitment to a fund, those commitments could then fall away if there is no pandemic that takes place, and then could be renewed at the tail end, for example. The other element I think to think about is what type of participation would the countries that would utilize this fund make. And one way to possibly address that is perhaps through some sort of a co-financing arrangement, where the users of this funding would also pay into a vehicle, and the payment terms and amounts and timing could be adjusted based on that particular country's economic status, for example. I think there was an earlier conversation, very interesting conversation, about the use of insurance products, and for example, parametric insurance, and how that could help at least provide some sort of visibility over a fixed amount or fixed payoff ex ante to a trigger event. I think if one were to look at a vehicle that has pre-commitments from donors, that is conditional, I think there could be some things to explore on how that can complement something like a parametric or an insurance product, because you probably are trying to accomplish two things, right? You want, on the one hand, you want availability of funding. You want availability of funding. Thank you. When it is needed. But on the other hand, you also, over the long term, probably want to develop a market where this risk can be better understood, better quantified, and better managed, and develop a way that risk is spread and the cost is spread over a broader base, so to speak. So I think what we're trying to solve for is probably both these two things: the availability of funding today, and then developing over time a market that is more participatory, that hopefully will have other players as well join in. Thank you.